No, see, our field, as a being a doctor, we have to serve this society. So people are coming with their problems. We have to solve them. We have to listen to them and try our level best to uh, relieve their symptoms and their problems. That is our main aim. And I have worked. I'm in this field. I'm in urology for last 27 years, and I have kept my patient always as the first priority and to serve them. That should be our motto. Yeah, I have done a lot of work, especially on transplant, renal transplant, and this in transplant I have got experience of more than 27 years. Initially, I worked in IKDRC Ahmedabad, then SGPGI Lucknow, that is well known for transplant in India and abroad. And then I have established more than 7 centers in India and abroad for kidney transplant. And I'm associated with more than 1,000 kidney transplant. And and we have developed, I'm really feel proud to that we have developed the laparoscopic donor nephrectomy technique while we were in the uh, MCH program in SGPGI, thanks to our mentor, Professor Anand Kumar, and Professor Bhandari that time, and Professor Anish. So we all worked together and we developed it. And laparoscopic donor nephrectomy first started in SGPGI Lucknow, and we had a lot of publications on that time. We compared the lab donor with the mini incision, like that. I have got publication in Journal of Urology on this, based on that, on mini incision. So we have done a lot of work on this. Similarly, for the prostate and in reconstructive urology, we have done work like urethroplasty, pyeloplasty. I have presented few papers in AUA also on the pyeloplasty and endopilotomy. That day it was quite popular. So we worked on that. Then stone surgery, we have done a lot of publication even for lithotripsy and for inferior caliceal stone, pros and cons of lithotripsy and all. Then pediatric lithotripsy, I have publication on that. So as we know, stone is prevalent in India, and we gradually, with the better, I think, screening program and better imaging now, we are getting smaller size stone. But in our time, in 20 years back, we used to get big stones, staghorn stones. We have done a lot of work on that, and being from the SGPGI, we have done large number of PCNL. I have trained many urologists, young urologists, to do PCNL in my career in India and abroad, and I really feel proud that I have been trained from that center. And it's uh, it's our now duty to train younger urologists. So more and more urologists are coming, and every year we are having uh, fellowship program in our center. We are giving training to people, new new generation, and they are really coming up well. Yeah, we have got many awards, best publication award also. Then in AUA also we got one of the best poster award way back in 2000, and then in North Zone and UCCon we got few awards for poster and our video presentations. We have presented in World Congress also our one of the video few years back in South Africa. So we have got, and during my residency, I believe in hard work, and I think that has paid over the years. I have got many times the best resident award during my even MS period also. Yeah, it's a very good question, and it's very important as well. Like for in our practice over the years, what we have learned that for younger people, we have to think about their um, sexual life as well, because with the alpha blocker, the main problem they get relief from the urinary symptoms, but they come back with in very anxious way that why there is retrograde ejaculation, it's a dry ejaculation. So retrograde ejaculation is more common we have seen with the silodosin group, and I think it is list with the alfuzosin group. So in younger age group, we usually prefer alfuzosin and older people, those who are above 65, 70, we prefer silodosin group. And of course, tamsulosin is time tested. Over the years, people have used it for more than 10 years with minimal side effects, but definitely retrograde ejaculation is there. So another important point deciding this is postural hypertension, whether what is blood pressure, systolic blood pressure of the patient. I consider that if it is around 100, it is really difficult to give this sort of alpha blocker. Then we have to select. I've seen patients with alfuzosin severe postural hypertension. I think it is maximum with the alfuzosin and least with the silodosin. Then people complain about postural hypertension in following taking this tamsulosin also, because there is fall in systolic BP by 4 to 8 millimeter of mercury. That literature also supports this. So we have to see age of the patient. Then number two is how much is what are other comorbid condition and what is their baseline BP. Third is severity of the disease. What we have seen, if acute symptoms are there and acute need of this impending retention, I have seen tremendous uh, effect of silodosin group. Silodosin gives quick response, and we can tide over this emergency in good number of cases. So in this way, and another important point is nowadays this is additional other than prostate is stone extraction, medical management of stone. And for this, all alfuzosin, tamsulosin, and silodosin are very well proven. And even for male and female, we are using this. Another important point I would like to add in female bladder outlet obstruction. That is myth in the society also that it will not work. People are coming, younger uh, females, they are coming with the bladder outlet obstruction, and we use alpha blockers for them, and it is effective. Of course, if you see theoretically, receptors are less, but it is very effective, and we have seen good response in female patients of bladder outlet obstruction, aerodynamically proven bladder outlet obstruction. So it can be given, but in the society there is myth even among our doctors, non-neurologists definitely. They think that you are given wrong medicine. So I think we should come out of this myth. It can be alpha blockers can be given even in females for their bladder outlet obstruction, and they usually respond very well. So it's used right from the prostate problem, either benign enlargement, impending retention, or prostatitis. In all, this alpha blocker is quite useful. Yeah. Patients with severe obstructive and irritative voiding symptoms. The patient has got fever and severe nocturia, and it is really bothering his quality of life. Then I think at that point, general physician should refer this patient to urologist. Definitely, and one most important thing before starting this treatment, they should give uh, advice for urine routine and culture that we are missing in most of the practice. So this should be given. So if urinary tract infection is there, that can be taken care of properly. Then ultrasound is very important, and kidney function. So urine culture, urine routine, kidney function test, and ultrasound, KUB and post-word residue should be done. And For that, we will be able to assess the upper and lower tract post-void residue. And another important point I would like to add here, like those who are above 50 years of age, male patient, presenting with urinary symptoms, we should consider them for serum PSA screening. That is very important. And as such, even there is no EUA guideline that how frequently it should be done. But what we advise generally that after 50, it should be done once in a year or once in 2 years. PSA should be done. By this, we will be able to detect early prostate cancer. So for patient, any patient visiting for this urinary symptoms, most important is proper history is very important. Whether patient is having obstructive or irritative voiding symptoms, that should be seen properly. And so proper history taking is very important. Our most of the patients in our rural background and towns, they are not uh, so aware of this filling the forms IPSS symptom score. Otherwise, it should be filled in the OPD itself by the patient. Questionnaire should be filled. And if they are not doing that, then at least we should follow all these points and we can ask during our history taking. Those who are literate persons, they usually fill the form. We usually follow this in our OPD also, that fill this questionnaire, and based on this, we can decide about mild, moderate, and severe symptom score and how much it is bothering the patient. That is very important. And based on this bothersome, how much it is bothersome, we can decide about the therapy. That it is mild, moderate, and how urgently he needs treatment. Based on this, whether we can keep on watchful waiting or whether irritative voiding symptoms are more prominent or obstructive voiding symptoms are more, that we have to differentiate properly and we have to treat accordingly. Then only we'll be able to succeed in relieving of their symptoms. So proper history is very important. We are using a very large number of patients, especially in elderly. I have seen a dramatic effect, especially patients presenting with nocturia. They are really bothered about that. 5 to 6 times in night they're passing urine. And silodosin I have seen, especially for nocturia, it is very useful. It reduces the number. Their sleep pattern will improve, and patient will be very happy with that. Only in younger people, I have found some difficulty because I have already discussed about the retrograde ejaculation that is more prominent, and we should tell. I have used it even in younger generation, but for stone disease we are using, but we are telling them that see, you might have this problem. It is not 100%. You may have this problem, so don't be panic with that, and it is reversible. That is most important message we should give. Another important is patient presenting with like acute prostatitis, impending urinary retention. I have found silodosin marvelous effect because it gives the early effect, I think, within 6 to 8 hours, and the quickest alpha blocker to respond in this kind of situation. So, and it is very well accepted by the elderly people. So, silodosin is really, it has made as a additional armamentarium or additional weapon for us, I will say, to deal our urinary this cases like BPH cases. It really helps. Yeah, definitely. It really responds very well, very quick. So those who are with impending retention of urine or acute prostatitis with severe or obstructive symptoms, we use silodosin even for younger people, and we get really dramatic effect. So in that way, it is really quick action within 4 to 6 hours. We can have this big effect. So, and no need to say that take it in the after dinner or so. Even in daytime, they can take it. Postural hypotension is also less. What we have seen in our practice, less as compared to alfuzosin and tamsulosin. Even in
Yes, yes.
daytime, if they are having problem, they can take this. And another, I have seen in severe cases, those who are not fit for surgery at that point, but having severe symptoms, we have added even BD dose also, like 8 mg in the night and 4 mg in the morning. I don't know what is feedback in your company about this, but we have used it and in few number of cases, and they have done well by this BD dose who are having severe symptoms, not going for surgery immediately, then 4 milligram in the morning, 8 in the night. I have used and I have found it quite useful. I have seen prescriptions of other urologists also, they are using like tamsulosin plus silodosin like that. But I have done only with the silodosin, like morning and evening dose. To some extent, patients they tolerate very well, even 12 mg in 24 hours. In prostatitis, we are using quite frequently. And number two, for medical management of stone disease, silodosin gives really quick action. Due to its quick action, even colic reduces, and even expulsion, spontaneous expulsion of stone is also quicker with silodosin. And we are using in good number of cases with when stone size is less than 5 mm. We have used and we got this success by managing medical. So silodosin is quick onset of action is really helpful for us. Yeah, definitely. They, we are here because of them, because of our parents. So it is our responsibility, our moral responsibility that now we should take care of them. Our parents, they are elderly now, and this is our responsibility, moral responsibility, social responsibility. I think they should be the first priority in our family members because they are elderly, they are dependent to some extent. So we should help them. We should try to take care of their problems as much as possible.
Yeah.
Cardiothoracic surgery. My initially, I planned for cardiac surgery, cardiothoracic surgery during my MS time. Then I have been trained. I was in the unit of urologist. So gradually, I have developed passion for urology. I'm very fond of cricket. So I had played till recently. I think I used to play cricket, and during my college days, and I've represented my college in the university as well as in the during medical college also till uh, MS. I've represented. I played and maintained it, and till last few years before COVID, we used to play cricket. So that is my passion. Second, music. I pass my time sometimes whatever time I get, and my family. Family is the first. I try to spend time. At least we should have dinner together, and we should share whole day experience and all this with our family. So family first, and another we should have 1 hour for us at least in a day. You can do whatever you like. You can listen to music. You can do exercise. You can write something, your diary if you're writing. And if your friends are there around, you can talk to them. You can give them surprise by calling them. And family members, you can talk frequently to the family members. And being doctor, we are many times we get lot of queries from family members, friends, all this. So at least 1 hour should be there for all of them, along with your own time to solve their problem. So I've been to many places. I like traveling, and there are so many places in this world, in India and abroad. Like I have not visited Andaman. I like to visit next few years. We'll plan then to cover Europe with my family. I have traveled a lot alone, but with my family, I would like to travel in Europe and explore part of South America. I have traveled to US few times, but to South America as well. We can travel. So traveling is also I like much. After COVID, during COVID, it has really reduced in last 2 years. So again, I would like to revive it. No, my favorite. I always I don't go for serials and other this either cricket or movies. So I watch cricket and I follow most of the time whatever 15 20 minutes I get in the last few overs, one day cricket or test cricket. So I usually like that. I follow other games also, like Commonwealth game is going on. I follow to some extent what is going on, how India is performing, like that. Few movies I really like, Three Idiots. Humor is very important in our life. No? So I think I like comedy movies like Three Idiots, Munna Bhai, MBBS, then few old serious movies. Every time we feel like few days back I was watching that movie. Then Chuck the India, being cricket fan, I also like that. Cricket, I'm a sports fan, definitely. And I consider my father as my hero, first of all. Actually, I am in this profession due to my father. He was doctor. So right from the childhood, I used to play doctor, patient. Right from my childhood, when I was 2, 3 years old, I used to play that game, and that passion was there. I think that's why I'm doctor. Rather, other than that, Amitabh Bachchan, still at the age of 79, is working so hard and is a great actor. So I usually follow him right from KBC and all his movies. Then Modi ji, being he is also a dynamic leader, hardworking leader. So we also follow him in that way. Definitely my family and my wife in all odds she has supported me right from my education time when I was doing super specialty till now. Actually, you have asked very difficult question. One person. I can name 2, 3 persons. So definitely out of this, my wife definitely because she's taking care of our family. I am most of the time out of this. She's also a doctor, but most of the time I am out of the home 12 hours, 14 hours, and she's taking care of my family. So main credit to her, other than my mother, because we are grown up in her hand, definitely. So women play a main role in our life in whatever way as a mother, as a wife, and as a daughter. So it's a great. I have got a single daughter. I really love her, and she gives real smile when I go back home. So really, they are very important part of my life. I like all kinds of food, veg, non-veg. You can say I'm foodie, not eating too much, but really, I like to test all foods, all cuisine, continental and Indian foods. I'm really fond of Mughlai foods, definitely, but even vegetarian foods. I like old Hindi songs. I like old Hindi songs. Still, they are very close to my heart, and still, I think these are all time. Still, it will remain in our heart. New movies, I'm not criticizing them, but we don't remember those songs. But old movie songs still we remember, and we love to listen after so many years. Old songs are my favorite.